Now, the KwaZulu-Natal government says while the province is not in a third wave of COVID-19 infections, data shows signs of a sustained increase of new cases. There are heightened concerns that the upcoming school holidays could possibly take the province into a third wave. Premier Sihlezi Kalala joins us now to talk about this. Premier, good evening, and thank you very much for your time tonight here on In Focus. So if you have a look at the numbers currently, you are the fourth highest, not technically in a third wave. The numbers are currently lower than other provinces. Firstly, what are you doing that has kept the numbers there, but what are you going to do in light of the mobility that comes with a winter break, that the numbers do stay at that level?
Well, firstly, what we are doing is to continue encouraging people to adhere to non-pharmaceutical measures, which is about prevention, including the whole issue of wearing masks, sanitizing or washing hands, social distancing, and not attending overcrowded places. We are all over with the message, creating the awareness. But we cannot say we are out of the woods. The danger is there, as you would notice that we have an increase in new infections that is quite worrying. 2 or a month ago, we will have less than 100 numbers on a daily basis. But now the average number would be 500 and something. And that is worrying. And that's why we have started intensifying the engagement and the awareness campaign, as well as tightening the implementation of regulations enforcement. We are going to go back to that level, and we would want to ensure that we fight complacent, and people should not just be relaxed. COVID-19 is still here, it is with us. We don't want to see the province going back, or the country going back to level 4 or level 5, where things will be closed.
Yeah.
And therefore, all must take responsibility right now.
Why wouldn't you want to go there, Premier? Let's look, for example, at how other parts of the world have handled the limitation of the spread of the virus. If you look at New South Wales in Australia, which is considered a success story in containing the virus, they did stricter border measures. They closed schools, they closed pubs, they closed churches, community centers, entertainment venues, and some of their beaches as well were closed. You look at Italy, who were slow to respond in the lead-up to the virus. They, of course, saw an explosion of cases which overwhelmed the health system. Yes, later on, they put the stricter health protocols in place, and they got the same results. The UK also began with a number of missteps, but after following Italy's style of lockdown, they regained control of the virus and over the transmission. Why would you say you don't want stricter measures? I mean, it's been proven that that could be the way.
We are not saying we don't want stricter measures. We are saying let us not behave in a way that will take us back. Let us all prevent the spread right now. Let us not be let's not allow the situation to escalate to a point where the province will also be hit by the third wave. Let us ensure that we embrace all measures that are currently in place, which we believe will help us avert going back to level 4 or 5.
Yeah.
But if it comes to the push, we will go that route, which will be unfortunate because we've seen it and we know how people feel if we close down everything. So we encourage people to be responsible and to behave in a manner that is in line with regulations.
There is a genuine concern of a lag in time in our responses, that we tend to respond when the numbers are beginning to rise, which in itself costs us lives. And you might be fourth in terms of the number of infections, but you are second in terms of the number of mortalities in the country, in the province.
No, we are second in the number of the highest cases in the country, and fourth in terms of fatalities after Eastern Cape, Western Cape, and Gauteng. But that does not mean we are all South Africa. We are in one country, and we cannot say this one is better or not. We all have to do whatever possible and what we can do as the leadership to avert the situation. If it comes to the push, yes, we can take drastic measures, but we have always been guided by the strategy of balancing livelihood and lives of our people. So we must protect the lives of our people so that they will be able to live. So balancing the two means be strict, but also allow economic activities and social activities to continue so that we don't collapse the economy as well.
Right, the biggest culprits you're saying are the young people, which you're worried about. So what is being done to prepare for the impact of a third wave on young people?
We are engaging with the youth in terms of their own activities, and in schools we are engaging with them. We believe that the message will reach all of them. We are, through the Department of Health, conducting roadshows that are creating an awareness among young people, and we are interacting with them through various platforms of the social media, creating an awareness that they should take responsibility and be part of us in this campaign.
There have been a number of events in the province, particularly of a traditional nature, and we understand, of course, it was a bereavement at the time, and these were seen to be quite large gatherings. But not only that, there are also large gatherings that are happening in the province attached to the appearances of certain ANC leaders in court. What is the province's view on how you're going to deal with such occurrences?
It is we are engaging with organizers of those activities as government to ensure that they follow the restrictions. Restrictions will have to be followed in every aspect. We are saying strictly, if it is a gathering, 100 people outside and 50 indoor. And therefore, we are not going to waive from that. We are going to continue and be strict on that.
And how are you intensifying the rollout, as the MEC for Health extrapolated earlier on to saying you are intensifying the rollout of vaccines?
That is one good progress we are making. We are intensifying the rollout of the vaccination in all districts within the province. We have vaccinated more than 365,000 of the people who are 60 and above. We've vaccinated health workers. In the second phase, we have vaccinated more than 130 in the second phase, and those are those who were left in the first phase. We will be starting on the 23rd of June, the vaccination of teachers in schools. We have established more than 91 sites where teachers will be vaccinated. We are also very inspired and moved by the enthusiasm of people to take vaccine, especially those who are above 60. While we've vaccinated more than 365,000, more than 510,000 are already registered in the electronic vaccination data system, which is capturing those who are registering. So you will see that people are willing to take vaccine, and we are making a good progress in that area.
Yeah. Are you strictly sticking to the registration online, or are you taking on those who come on the day and need to be vaccinated, especially those who are over the age of 60?
We accept the walk-ins but we don't encourage them, because in some cases, once you allow the walk-ins, you will find a situation where people will flood the area, the vaccination site, and they will come simultaneously, and we will not be able to manage the process well, given that we've got a lot of vaccination sites and not so many staff who are there. So we would want to plan accordingly. But once a person gets into the vaccination site, she or he gets registered. If the space allows, she will be then vaccinated on the day, or she will then be given, or he be given the next the allocation as to when the person can come to take the vaccine.
Right. Speaking of allocation, then what are the resources, manpower, human resources allocated to the number possibly of people who might want to travel this winter break and come your side?
Well, we will look on that, but we will have to focus firstly on people who have registered. Now, we will expect those who will be coming for holidays to come to the province. Firstly, where they reside, we believe they would have taken the vaccine. If they come to the province, they must also follow the non-preventative measures, the non-pharmaceutical measures that are in place, so that they will also be able to prevent the spread and protect themselves and their loved ones.
Premier, we appreciate your time and thank you very much for joining us on In Focus. The Premier of KwaZulu-Natal, Sihle Zikalala, giving us an update on the work being done currently to prevent the spread of the virus in the province.